Welcome to Neo Pharmacy, your favourite weekly podcast on the latest pharmaceutical drugs. Today we're discussing postpartum depression, or PPD, a major depressive episode that occurs from the third trimester to 4 weeks after childbirth and affects 10 to 20% of childbearing women. Dr. Caitlin Hill, a member of the Sage Therapeutics team, is here today to explain the recently released medicine Zulresso that she helped develop. This groundbreaking new medicine, which contains the active ingredient Brexanolone, is given intravenously over a 60-hour period under medical supervision to treat severe PPD. Welcome, Dr. Hill.
Thank you, Belinda. PPD not only causes mothers to lose interest in their newborns and experience low moods, but it also impacts the infant's physical, emotional, and behavioural development. Previously, we could only treat mothers with standard antidepressants, hormonal therapies, and psychotherapy, so the development of a treatment of this type is critical.
Of course, it's a much-needed leap forward. So before we talk about Brexanolone, can you please tell us how PPD actually works?
While the pathogenesis is unclear, the onset of postpartum depression has been linked to coincide with rapid declines of perinatal hormones, particularly the progesterone metabolite allopregnanolone. Brexanolone is an exogenous synthetic version of this metabolite that helps balance these fluctuating levels in mothers.
Before we go any further, could you perhaps explain the mechanism behind how this medicine works to those who have never heard of it?
Of course. I'll attempt to be as brief as possible. Brexanolone is an agonist that acts by boosting the inhibitory effects of the neurotransmitter called gamma-aminobutyric acid, or GABA, at the GABA-A receptors, which are ion channels present throughout the brain and are vital for physiological activities including mood regulation. Brexanolone increases the chloride ion channel's opening frequency and duration inside the receptor complex by binding to a specific region of the GABA-A receptor complex. As a result of this surge, the neuronal membrane becomes hyperpolarized, increasing its resistance to stimulation and lowering neuronal activity.
I came across a few clinical trials during my research. Could you provide us a little background information on Sage Therapeutics studies?
Sure. So firstly, there was a randomized, double-blind, placebo-controlled phase 2 trial of Brexanolone for the treatment of PPD, followed by 2 multi-center double-blind, randomized, placebo-controlled phase 3 clinical trials, testing mothers with severe PPD, defined as a HAM-D score of 26 or greater.
I'll just stop you for a moment. What exactly is a HAM-D score?
Essentially, a HAM-D score is a depression evaluation scale out of 52, with higher value indicating more severe depression. A score of 24 or greater indicates severe depression.
Thank you for that clarification. Getting back to those clinical trials though, can you provide us an update on the findings?
These trials found that Brexanolone treatment reduced the HAM-D score significantly and clinically meaningfully in comparison to placebo in women with severe PPD. It also encouraged further research into the possibility of treating PPD in the future by targeting synaptic and extrasynaptic GABA-A receptors. Therefore, the conclusion of these studies found that Brexanolone has the potential to improve therapy options for women who have been diagnosed with postpartum depression with its quick onset of action and long-lasting therapeutic effect.
Did these trials perhaps demonstrate any negative effects?
The most often reported side effects were sedation, dry mouth, and sudden loss of consciousness.
Is that risk of loss of consciousness the reason why it's delivered in a hospital setting?
Yes, the risk of excessive sedation and sudden loss of consciousness are the reason that Zulresso was approved with what the FDA refers to as a risk evaluation and mitigation strategy, which means that Zulresso is only available to patients in certified healthcare facilities under the supervision of their healthcare provider.
Then, given how meticulously it must be taken during treatment, is it safe to use Zulresso while nursing?
One small-scale study examined Brexanolone levels in the plasma and breast milk of 12 women during and after they had Zulresso therapy, indicating the relative infant dose is minimal. However, Sage Therapeutics advises breastfeeding mothers to discuss the advantages and disadvantages of continuing breastfeeding with their healthcare provider until more information from large-scale trials is available.
Yes, it is essential that everyone, especially nursing mothers, should consult with their doctors before considering any new medication.
Absolutely.
Before we wrap up, just quickly, where do you envision the future of this drug's research going?
More research into Brexanolone's ability to treat women in the long term is required, as well as its ability to treat women with various degrees of PPD severity. Phase 2 and 3 trials are also underway to demonstrate that this medicine can be used orally. As a result of this enhanced public accessibility, Zulresso may eventually become primary treatment for PPD. However, some of the more severe adverse effects must be addressed first.
Wow, that sounds like a pretty exciting field for further study, and it appears that Zulresso may be really important in the management of PPD.
Absolutely.
Well, thank you so much for speaking with us today, Dr. Hill. I wish you and Sage Therapeutics the best of luck. We're all interested to see where this PPD treatment will eventually lead. Thank you, Belinda.